This is Salma Schimmel at the annual ASCO meeting in Chicago, and we're bringing you to a poster session. You've heard us talk about poster sessions, but what is a poster session? So now we are with Dr. Daniel Van Hoff, Physician-in-Chief, Translational Genomics Research Institute in Arizona. Hi.
Yeah,
nice
to meet
see you. What's a poster session?
Poster session is probably one of the most effective ways to communicate with our colleagues. And so what we do is we have a representation of the data of the study, first of all, the design of the study, and then the results, and then we try to have some conclusions. And it's a chance for people to ask pretty tough questions, how we did it, and what the implications are. So it's probably one of the best methods of communication.
And in the research world, once you present a poster session, what seems to follow?
Usually what follows is a more formal publication for even more careful analyses. But this is the first communication usually to try to get these findings out for other people to think about.
And so this is a rare opportunity for patients to actually see what goes on behind the scenes as new therapies and research come to light.
Absolutely. This is the first, usually the first presentation that occurs.
All right. So guys, you're getting an inside look about what happens as studies come to life. Let's talk about your study, which has to do with pancreatic cancer.
Right. What we're trying to do, because everyone knows that pancreas cancer is a very difficult malignancy, is we're trying to find new targets to try to treat patients more effectively and with less toxicities. The reason that we've done this is that we did this a few years ago and found a target called SPARC, S-P-A-R-C, and we used a drug to target SPARC, and we got 68% of patients' tumors to shrink. And we had, the usual survivorship has been 0 at 2 years, but this one caused 25% of people to be alive, and some 3 and 4 years alive now. So since we had a promising result there, the question is, what could we add on next? So we went, instead of 16 original patients, 1,000 patients, 1,029 to be exact, and looked for new targets in those patients' tumors.
So this was a high-powered study.
Yes, and with more confidence.
And was this a global study?
This is a global study. The tumors were submitted from docs all over the world.
Could you take a minute and just talk to us about the importance of tissue collection on behalf of pancreatic cancer?
Well, when you have a tumor type that's as tough as pancreatic cancer, we have some things now that improve survival used first, but when a person's tumor progresses on that therapy, we say the therapy fails them. And then you're looking for what can I do next? And that's where the support of Stand Up to Cancer and others has been so important. So the patient has a biopsy, and we're looking for things to treat those patients whose tumors have progressed on prior therapies.
For a pancreas cancer patient that's watching this interview now, looking at this, how is this relevant to them, if at all, today? Is there anything here that they should be going back to discuss with their doctors? Are there molecular tests that they should be having on their tissue?
Yes, I think it's very, very important. If the therapy is not working for the patient, the number one message is have a biopsy done to try to find if there is a target so that the next therapy could be selected. Second thing is hang in there, because there are advances against this disease. You must measure something, though, to give the next best chance.
I want to thank you and also compliment you for something you said. You didn't say the patient failed the therapy. You said it failed the patient. And that is such an important psychosocial, for me, distinction, because it's not the patient that failed. The patient didn't do anything wrong.
No, we failed them.
But with good-hearted intentions, and it leads. Something that fails leads to an opportunity to learn and to grow and look at something new.
Absolutely, and I think everyone who's had these biopsies to make this happen, they're very special because they're trying to help themselves and others, most importantly others.
So there's people here who want to come and talk to you.
Okay.
We wanted a chance to share and teach what is a poster session, and thank you so much
for your work.
Thanks
for doing it.
My pleasure.
Thank you.
Thank you.